the community doctors have a lot on their plate. They see all kinds of cancers. This whole field of cancer has grown exponentially from when I was in training. And it's hard sometimes to keep up with everything. Add to that, the kidney cancer is not the most common cancer. We see a lot more breast and lung and colon cancer than we do kidney cancer. So there may be situations where your physician might not be as familiar with some of these newer kind of breakthroughs or advances in the field as, say, the academic centers. You should absolutely give them a chance to talk about, what's new and what's available and whatnot. But you can also, seek out information yourselves. And that's one of the great things now with the information available to folks. And there are experts around the country that can help you as well. So there's a lot of medical resources out there. Use them. Use your local team. Use your regional referral centers. Use what you can learn from others to really educate what's the best course for you. I think one of the other areas of stress and frankly an obstacle for many of our patients undergoing treatment with kidney cancer, chronic disease that we may treat for years, is the out-of-pocket expense associated with some of these therapies. Medical expenses have really gone through the roof, and there are the cost of insurance, but there's also the cost of the copays. And in kidney cancer, I think it's one of the great things in this field is that we have a lot of oral therapies that give patients control and give us as the treating physician team, opportunity to sort of manage their side effects accordingly to their dose and to have good control over how much medicine they take. But one of the downsides is a lot of oral therapies have associated with them a lot of copays, and it can be a real struggle for patients. And understanding how to navigate that, some patients could feel they're not worth it. I've seen all kinds of reactions to those added costs. I think one thing that's really critical to know is that we should talk about it. It's something you need to talk about with your physician team. There's a lot of resources out there. Patients are not going to know about these, but the hospitals, the clinics do. And there are resources through pharmacy. There are resources through third-party nonprofits. There are resources through the pharmaceutical companies themselves that they can help support different levels of income for patients to help make these drugs affordable. We've had patients get drug for free. We've had other patients get supplemental support. And it makes a huge difference, because if someone's going to respond to a therapy for years, but it's going to drain all of their resources, they may give up too soon. And that's a shame when we have a therapy that's working that the patients give up on. So to me, this is it's a critical thing to talk about. We try to bring it up and recognize it, but people should not feel ashamed about it. It is a reality that we all have to deal with, and thankfully, there's a lot we can do to help.